The intersection of mission and margin is the business of healthcare. Blake Margraf, Brooks Daverman, thank you so much for joining the business of healthcare. Tell me a little bit, Brooks, about your role and responsibility at TennCare.
Sure, I'm the Director of Strategic Planning at TennCare, and I'm working on a project to change how healthcare is paid for in Tennessee, working with TennCare, which is our Medicaid program, but also Cover Kids, our CHIP program, state employees, and the large insurers in the state.
So that's a pretty bold responsibility, changing how healthcare is paid for in Tennessee. Let's go a little deeper into that.
Sure, so we have three main strategies. So we have a strategy that's around primary care and behavioral health with a number of different elements. We have a strategy that is called episodes of care that is around acute and specialist-driven care. And then, and this is especially important for a Medicaid population, we have a strategy that is for long-term services and supports, which is nursing facilities or people who are getting help in a home or community-based setting.
Blake, tell me about your work.
Sure. So I founded and now run the digital health company ePharmix. Premise is pretty simple. ePharmix helps keep the 20% of toughest patients, high and rising, in touch with their risk-bearing outpatient care management teams. Because ePharmix helps support the chronic condition monitoring for patients that are generally medically underserved and also high rising risk, ePharmix works by tracking those chronic conditions with disease-specific tools that collect patient-reported signs and symptoms for the long term. And those tools are designed through a pretty extensive research and development process that culminates in peer-reviewed literature publication. ePharmix
began as a research project, right?
Exactly right. So ePharmix started when my co-founders and I got a multi-center IRB pushed through, relatively small, and were able to show a more than 50% reduction in hospitalizations for dialysis patients. And from there, some care managers started approaching us saying, that's cool, can you do that for COPD, diabetes, heart failure, substance use?